All right, so I'm gonna do my assessment finding on a decreased level of consciousness. So one significant assessment finding associated with intracranial hypertension is a decrease in the level of consciousness. So is the patient suddenly gonna become confused, restless, lethargic? Are you having difficulty arousing the patient? So changes in the level of consciousness are often the earliest and the most sensitive indicator of increased intracranial pressure. And basically, this is occurring because of the elevated intracranial pressure is going to reduce the cerebral perfusion pressure. So that basically means that there's going to be less oxygenated blood delivered to the brain. And when there's less oxygenated blood delivered to the brain, the brain is unable to do its basic function. So as the brain becomes more deprived of oxygen, its neuronal function becomes impaired. And this leads to the symptoms such as altered mental status, including confusion, decreased responsiveness. Are they lethargic? So as the pressure continues to rise and the compression of the brain structures worsen, it's going to result in the patient becoming more and more of a decrease in the level of consciousness. So they're going to have stupor, coma, and then eventually brain herniation if it's left untreated. So the key nursing intervention to prevent this complication is you want to be doing frequent neurochecks on your patient. So you want to monitor their Glasgow Coma Scale. You want to monitor their orientation. You want to check their pupils. You want to check their motor responses in their arms and their legs. You want to recognize anything that changes that's like sudden, because early recognition allows for you to notify the doctor and to hopefully like nip it in the bud and catch it early, which is going to lead to a better outcome for the patient. Additionally, the nurse, what you can also do is have the head of the bed at a 30-degree angle and make sure that the head and the neck are in neutral alignment. And this is going to allow for venous drainage of the brain and hopefully reduce that intracranial pressure. You also want to minimize any environmental stimuli. And if you notice any changes that are like quick and not at baseline for the patient, make sure that you notify the provider and that you do a really good assessment on them.